Hello everyone, I am Dr. Mansi from Homeopathy 360 and we are back again with another session on another day under Beyond Boundary with Homeopathy 360 webinar series. I welcome you all and a special and warm welcome to Dr. Anum Zaheer ma'am. Thank you so much for being our guest speaker on this platform. Dr. Anum Zaheer is a highly accomplished and versatile homeopathic physician. She holds a BHMS, MD Homeopathic, and PGDEMS qualification, and she is a gold medalist in her undergraduate and PG education. With a patient centric approach, she specializes in treating chronic conditions. Dr. Zaheer actively conducts online and offline sessions on healthcare and medicine, engaging with students and the general public through her social media profiles. She also educates the students and physicians on her YouTube, guiding them about the clinical tips, clinical cases, and whatnot. We are really inspired with Dr. Anum Zaheer ma'am. Her notable achievements include winning the Sharda Desai Gold Medal and having her MD research recognized as the best dissertation by CCRH in 2029. In 2019. She has co authored homeopathic books and written multiple articles on medical topics on international and national levels, alongside her clinical practice at 5 clinics and online consultation worldwide. She actively participates in public awareness for workshop, medical camps, and outreach activities. Her dedication to healthcare education and her establishment of a homeopathic dermatology department at Jan Seva Trust exemplify her commitment to serving community. Thank you so much, ma'am. You have you have contributed on the homeopathy field too much, and we are really inspired by you. And today we are going to learn
Thank you
on
so
Boger's
much,
concept.
Dr. Mansi.
Thank you, ma'am.
So, hello everyone. I hope I am audible to every one of you. Okay.
Yes, ma'am. You are audible.
So, I'll share my screen, right?
Yes, ma'am. You want to share your screen? Please present.
Is the PPT visible to everyone?
Yes, ma'am. PPT is clearly visible.
Good. So, I'll tell you why I've selected this topic, bogus philosophy and pathological generals. See, I get a lot of DM on Instagram, Facebook. Students sending me cases and health. I've given 1 dose of this. This medicine was given. No improvement with this medicine. Please tell medicine for that. Okay. People also ask, students ask, ma'am, which repertory to use, and ma'am, what symptoms you have taken in the case. So somehow, somewhere, I feel that there is lack of knowledge and application of philosophy somewhere in BHMS students, and that's why they are not able to get what is happening in the case, what you need to take in the case. Even if your drug is correct, I'll tell you. Recently, one of my fellow junior, she called me, and it was a case of abscess today only, and abscess was not ruptured; it was angry red, and is in the armpit. And the junior was so anxious, ma'am. I've given medicine Cilicia 1M, and the pus is not coming out. Patient is having fever, and patient is, is having a lot of pain. I completely agree. Cilicia could be possibly the correct medicine, but just 1 dose of 1M, you see how acute, how severe, how angry, how ferocious the abscess is. So why you have stopped with just 1 dose, right? If you have given multiple doses, or if you have given, in TDS Cilicia 1M, this might have came out. So many students, they ask what to take in case, what to leave in case. I absolutely agree that you should know pathology per se, practice of medicine, because you need to differentiate between common and uncommon symptoms, which is the basic you should know. Someone with the complaint of Bright's disease, okay, coming to you, he is complaining of swelling, anasarca. Now, if you take swelling as a general symptom, so I don't think it's going to help you uh, with the case, because if you know Bright disease, you must be knowing that albuminuria is very common, and when there is albuminuria, there is general anasarca in the cases, right? So knowledge of pathology, it is very, very essential. Let's move forward. We'll give a very quick review. We'll talk only on the clinical aspects. If you have your question, your cases, I request you all have, if you have small cases, we'll discuss your cases, okay? So I'm personally a very big fan of Dr. Boger, and by end of the session, you'll be knowing why so. So his father was professor. He was born in 1861. His father was professor principal. You know, he was from very learned family, and he knew homeopathic philosophy so fluently. He has given a lot of lectures, and you know what made Boger so learned, because he has done a lot of translation of the writings. And it is so amazed to know that even Master Hahnemann came into homeopathy just because of translating books, because that was his bread and butter that time. And by translating books, he came up into homeopathy. So he was, he was his whole life he has translated, and he was the very firm follower of Bonnie. You will see this. So if you see his work, his writings, you will see that he has given a lot of additions and translations to Bonninghausen writings as well. He has contributed a lot, and I'll tell you his work also, what various kind of repertories and books he has published, he has worked on, and which are, even after 200 years, they are still valid. We use them. So, among them, Boger Synoptic Key is one of my most favorite literature. And I request each and every one of you that you should have Boger Synoptic Key at your bedside and start using it clinically, because abhi you are taking long cases, you are having 4 or 5 patients at a time, or 10 patients or 12 patients at a time. But by the time your clinic will grow and you'll have 100 patients, 120 patients, you know, so then you'll realize that how useful Boger's writing, his repertory, his materia medica is. Okay. So as I've discussed is that Dr. Boger was extensively inspired by Bonninghausen's work and philosophy. And Boger's synoptic key was initially was the extraction of marked rubrics only. And Boger's synoptic key, if you see, has derived from work of previous authors only. He has just refined it. I'll tell you how there is influence of Master Hahnemann also in Boger's work. Of even Dr. Kent, influence is also there in his work. Okay, so these are few writings I have written. He has done the translation of repertory of Antisoric. If you remember that Antisoric, it was the basis for therapeutic pocketbook of Bonninghausen. BBCR 1905, Synoptic Key, Times and Moon Phases 1906, General Analysis, Studies in Philosophy and Healing. Addition to Kent's repertory was done by Boger. Translation of therapeutic pocketbook, and there is a card repertory also of Boger. I don't know how many of you have these. I have many of these, and trust me, they are worth it. Matlab, must have books. These are okay. Let's talk about a little about philosophy. Trust me, if you be with me, it's not gonna be boring at all. Okay, so Boger was very close to Bonninghausen, and Bonninghausen was very close to Master Hahnemann. I'll tell you. Master Hahnemann, what he said that don't look for parts, or don't look for disease, look for the patient as a whole, right? We read this all over the organ. Bonninghausen was the man who brought up, the concept of grand generalization. He just said his philosophy of Bonninghausen was what is true for a part is true for a whole. Master Hahnemann said, don't give importance to the parts, just give importance to person. Even Kent was like this. I am thirsty. I'm upset. I. It's not my. More focus on I. Okay, which was later divided into mental generals and physical generals, will, understanding, intellect, right? So Bonninghausen came up with the concept of grand generalization. What is true for a part is true for a whole. Now, कोई भी थ्योरी आती है तो उससे पहले उसका एक कोई ना कोई ग्लिच जरूर होता है ना, तभी तो वो पीछे रहती है और नए एडवांसमेंट होते हैं. इट इज एवरीवेयर इन मेडिसिन. There were few stalwarts who raised a question कि ठीक है, हम आपकी बात मान लेते हैं. If I pick up a symptom like labor-like pain, okay, अगर आप ये कह रहे हैं कि लोकेशन, सेंसेशन, मोडालिटी, कॉन्कोमिटेंट पेशेंट को एज अ होल प्रिडिक्ट करते हैं, तो अगर लोकेशन आई है और सेंसेशन लेबर लाइक पेन है, सो इज इट रियली फीसिबल? एंड हियर कम्स द शॉर्टकमिंग ऑफ बॉनिंगहाउसन की ग्रैंड जनरलाइजेशन. आप सब चीज को ग्रैंड जनरलाइज नहीं कर सकते. Here comes Master Kent. What Master Kent said: if a symptom is present in two or more than two parts, you make it as a general. For example, doctor, I'm having a lot of burning while eating. I'm not able to eat. I also have burning in my palms and soles in the night. I can't cover them. They burn like anything. Now this burning becomes general because it is present in two parts. And now you can use it as a generalization symptom. मजा आ रहा है सबको? We'll take it very easy, very easy. At least you'll be able to use it this in practice. है ना? इस सेशन के बाद ऐसा नहीं लगेगा कि क्या ले और क्या छोड़े, क्या नहीं लेना है, right? तो Boger was the one who bridged between Kent and Bonninghausen. अभी Kent की limitation बताती हूँ. अभी थोड़ा सा. Pardon me. अभी Kent ने रिपोर्टरी लिखी, डॉक्टर केंट ने रिपोर्टरी लिखी, तो स्टमक लिखा, बर्निंग स्टमक के अंदर. हेड लिखा, पेन लिखा, बर्निंग. एक्सट्रीमिटी का चैप्टर बनाया, 800 पेज का चैप्टर है, बर्निंग. फीट में अलग, सोल में अलग, ले बर्निंग, ले बर्निंग. अरे बाप रे, बर्निंग ना हो गई, आफत हो गई. Now you can see the two variations. What Dr. Boger did, he bridged it between Dr. Kent and Dr. Bonnicas. मैं आपको ये भी बताती हूँ कि हाउ ही केम अप टू दिस कॉन्सेप्ट. एक मास्टरमाइंड होता है ना किसी भी चीज के पीछे, है ना? अभी न्यूटन के सर पे सेब गिरा था तो ही डिस्कवर्ड ग्रेविटी. मेरे सर पे गिरा होता तो मैं खा के क्लिनिक चली जाती शायद. वो ग्रेविटी आज तक कभी डिस्कवर ही नहीं हुई. टू बी वेरी ऑनेस्ट, देयर इज समथिंग इन बैक ऑफ द माइंड of someone who is the discoverer, right? So Dr. Boger was practicing in US और उनको बहुत ही तकलीफ हो रही थी इस मिनिमम निकालने में, आपके और मेरी तरह. और उससे भी ज्यादा उन्हें तकलीफ ये थी कि जब सिमिलिमम आता था तो टाइम बहुत लगता था. Now he saw कि practitioners are very much dependent on faulty translation. जिसका जो मन आ रहा है वो ट्रांसलेट कर रहा है, फ्रेंच से इंग्लिश में, इंग्लिश से फ्रेंच में, जिसका जो मन आ रहा है वो कर रहा है. Then सबसे पहले what he did, he took up the task of translating repertory of antisoric, or he translated it in 1899. Translate करते 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 he was fully convinced that Bonninghausen के principles को basic तो बनाया जा सकता है, कंस्ट्रक्शन भी बढ़िया हुआ है, बुक भी प्रैक्टिकल है, लेकिन वो ग्रैंड जनरलाइजेशन वाला जो है उसमें उसमें बात नहीं बनेगी। ही उसको मालूम था देयर इज लॉट ऑफ डिफिकल्टीज इन थेरेपेटिक पॉकेट बुक। आई डोंट नो आप लोगों में से कितने लोगों को मालूम होगा थेरेपेटिक पॉकेट बुक के बारे में और कितनों ने यूज किया होगा। थेरेपेटिक पॉकेट बुक में ना रेमेडी रिलेशनशिप का चैप्टर, इट इज वन ऑफ माय मोस्ट फेवरेट। आप उसको देखेंगे तो आपको लगेगा कि व्हाट अ ब्यूटी, इफ यू नो हाउ टू यूज इट ना, उसके बाद आपको फॉलो अप में कभी प्रॉब्लम नहीं होगी। फॉलो अप विल बी वेरी इजी कि नेक्स्ट रेमेडी क्या देनी है। तो he was very much aware of difficulties, what practitioners were facing therapeutic pocket book को यूज करते में। and that time तो that was a time in homeopathy कि कोई अच्छा काम भी कर रहा है तो उसका पैर पकड़ के खींचने वाला हिसाब है ना। so there was mostly criticism all over for Bonninghausen. So he took up the work and he what he did, he matlab, just a second. Yeah. So he took up the work, Bonninghausen की repertory का. He added new chapters, new medicines, है ना? And even after publication, or एक चीज और which one thing I'm missing here is he modified few chapters of therapeutic pocket book. He added symptoms also, medicines also, modality also, concomitant also at the end of each chapter. And there become, it was published as BVCR in 1905. इसका एक एडिशन आज भी मौजूद है. Even after publication of first edition of Boger continued to work on repertory, but second publication में unfortunately he was not there, and he died of canned tomato poisoning, right? So later the manuscript was published with the assistance of his wife by Roy and Company in 1937, and this can be considered as first Indian edition of Boger's repertory. Boger subscribed to principle of totality, which was originally this philosophy of Master Hahnemann. How beautiful it is कि इतना काम करने के बाद भी Dr. Boger has not disturbed or played with the beauty and what we call authenticity, originality of philosophy of Master Hahnemann. यहाँ ना एक बेसिक फंडामेंटल कॉन्सेप्ट समझेंगे अबाउट डॉक्टर बोगर. डॉक्टर बोगर ने बोला कि भाई ये बेसिक चीजें हैं, इन्हें आपको समझना चाहिए और आप आगे as we move forward you will see how you can use them in your clinical practice. सबसे पहला था डॉक्ट्राइन ऑफ कंप्लीट सिम्टम. मास्टर बॉर्निंगहाउसन ने भी ऐसे बोला था ना, कैसे कंप्लीट कर लो, लोकेशन, सेंसेशन, मोडालिटी एंड कॉन्कोमिटेंट, राइट? सिंपल. फिर डॉक्ट्राइन ऑफ पैथोलॉजिकल जनरल. पैथोलॉजिकल जनरल्स क्या होते हैं मैं आपको आगे बताती हूँ, एंड नेक्स्ट टाइम आपको पिक करने में भी बहुत आसानी होगी केस में. डॉक्ट्राइन ऑफ कॉजेशन एंड टाइम, हाउ ब्यूटिफुल इट इज. ड्राफ्ट ऑफ कोल्ड एयर, एकोनाइट, है ना. डलनेस कॉजेशन है, गेटिंग वेट, ड्रेंच्ड इन रेन, रस्टॉक्स. ailments after swimming, brainia, change of weather, dull ka mara, doctor position, time, 4 p.m. aggravation, Thuja, 3 p.m. aggravation, Napis, 3 a.m. aggravation, Kalikar. If you see Boger synoptic, you'll see that it is there in repertory. Very well mentioned. Clinical rubrics. Clinical rubrics जैसे I'll tell you there's so many clinical tumors, right? Cyst. As soon as you have stamped it as a diagnosis of the case, you can see the same rubric in the repertory also. Another very unique feature of Boger's working was fever totality. It is a very unique contribution of Boger, I must say. And this section is considered as a self-explained or self-limiting, अपने आप में self-accomplished rather I say, है ना. It has repertory also. Every stage of fever is mentioned, the time, aggravation, amelioration, the concomitant. It is almost complete, we can say. There come concordance. I was talking about the remedy relationship. This concept has came from Bonninghausen's therapeutic pocket book only. इतनी क्रिटिसाइज करने के बाद भी डॉक्टर केंट हैज यूज्ड, इतना क्रिटिसिज्म किया बॉर्निंघहाउसन का, इतना क्रिटिसिज्म किया, फिर भी he has used this उनका रेमेडी रिलेशनशिप वाला चैप्टर. Concordance, it deals with the relationship of 125 remedies and it can be used for studying relationship of remedies at various level. कभी कोई सेशन लेंगे और मैं आपको ये सिखाऊंगी कि ये वाले सेक्शन को ना यूज कैसे करना है, तो बहुत मजा आएगा आप लोगों को फॉलो अप लेने में. स्पेशली एक्यूट का क्रॉनिक हो गया तो क्रॉनिक का एक्यूट हो गया तो इफ डिजीज हैज चेंज द स्फेयर ऑफ एक्शन तो है ना, पेशेंट इज गेटिंग बेटर लेकिन डिजीज ट्रैवल कर गई स्किन से जो है वो ब्रोंकाइटिस हो गया. अभी तक तो डर्माटाइटिस था, डर्माटाइटिस फाइन बट पेशेंट टर्न्ड आउट टू बी ब्रोंकाइटिस, केसेस ऑफ सपरेशन. सो दिस सेक्शन इज रियली अमेजिंग. दिस इज वेरी इंपॉर्टेंट, यू शुड बी नोइंग. तो क्या है कॉन्सेप्ट ऑफ पैथोलॉजिकल जर्नल? देयर इज पैथोलॉजिकल जर्नल इज बेसिकली अ सर्टेन जनरल टेंडेंसी है टिश्यू की. ऐसे टिश्यू जो नॉर्मल नहीं है, एबनॉर्मल है. टेंडेंसी ऑफ टिश्यू, व्हाट काइंड ऑफ टेंडेंसी? एबनॉर्मल टेंडेंसी, जनरल टेंडेंसी ऑफ टिश्यू जिसमें एबनॉर्मल चेंजेस हो, और they are so important that you will be able to reach to your remedy or relay or simillimum with that change. And Boger was the one who came with the concept of pathological general. आपको पता है इन BBCR pathological general बहुत सारे मिलेंगे. if you open chapter sensation and complaint, you will not, I don't think any other repertory has sensation and complaint का chapter अलग. Yeah, it is scattered in other repertory. And it is also very helpful in later stages of differentiation. If you ask me, even pathological journals में miasm भी है. And you can take, even if you don't want to take it in your repertorial totality, you can take it as an eliminating symptom also. I'll tell you how. There's certain criteria. अभी आप लोगों ने BHMS में एडमिशन लिया, BHMS वाले बच्चे MD करते हैं. So there's certain criteria कि भाई आपने 12th किया हो, एक सर्टन मार्क से किया हो, आपके पास बायोलॉजी. अब कोई भी MD मटीरियल मेडिका कैसे करेगा? उसके पास कम से कम BHMS हो, ऑल इंडिया का एंट्रेंस एग्जाम क्लियर किया हो, एक सर्टन रैंक हो. सो देयर इज ऑलवेज अ क्राइटेरिया, राइट? पैथोलॉजिकल जनरल के लिए भी ना क्राइटेरिया है. मैंने क्या बताया? टेंडेंसी हो, एबनॉर्मल हो और जनरलाइज हो, राइट? अब आप देखो बॉडी के सारे डिस्चार्जेस जनरल होते हैं ना. आप ये तो नहीं कह सकते ना, मैं अगर कहूं कि ब्लडी नेजल डिस्चार्ज है, या स्टूल फ्रॉथी है, या एक्सपेक्टोरेंट थिक, एक्सपेक्टोरेशन थिक है, स्टिकी है, विसिड है, तो मैं किसी एक पार्ट के बारे में बात नहीं कर रही हूँ. मैं कभी कोई पेशेंट ये नहीं कहेगा कि माय माय मतलब माय स्टूल हैज ब्लड या ऐसा कुछ. वो कहेगा आई एम हैविंग पर रेक्टल ब्लीडिंग, आई एम हैविंग blood and stools, right? This is something which is related to eye, मतलब पूरी बॉडी एज अ होल. तो बॉडी का कोई भी डिस्चार्ज, ब्लडी हो, थिक हो, विसिड हो, मशी हो, फ्रॉथी हो, क्या बन सकते हैं? पैथोलॉजिकल जनरल बन सकते हैं. तो नेक्स्ट टाइम इफ यू गेट एनी काइंड ऑफ डिस्चार्ज, डोंट मिस इट. अभी जैसे सार डिस्चार्जेस हैं, यू हैव कैलकेरिया कार्ब, हिपार सल्फ, यू हैव र्यूम, राइट? फॉर एग्जाम्पल डिस्चार्जेस डिफिकल्ट टू वॉश, स्टेन इज डिफिकल्ट टू वॉश. आप कैसे मिस कर सकते हैं? ये तो बॉडी को एज अ होल प्रिडिक्ट कर रहा है. सो इट इज अ पैथोलॉजिकल जनरल. सिलिशिया, मर्क, मैग्नीशियम्स, कोई भी लोकेशन पैथोलॉजिकल जनरल भी बन सकती है. आई हैव ट्रीटेड hundreds and hundreds of cases of atopic dermatitis and eczema when kid is only having eruptions on the folds of knee or elbow. I just take rubric flexors. There's a rubric flexors folds करके रिपर्टरी में आपको मिलेंगे ग्रेफाइटिस सोरेनम, एंड they'll definitely work if your modality, if your case matches. ज्यादा सोचना ही नहीं है. कोई डोमिनेंट मायाजम भी पैथोलॉजिकल जर्नल बन सकता है. I'll tell you. If I have lot of patients. एक पेशेंट है मेरे पास who's having बड़े बड़े वॉट, लार्ज वॉट. एंड इफ यू सी रिपोर्टरी, लार्ज वॉट में तो जैसे भी वॉट का नाम आता है, यू ऑल थिंक अबाउट थ्यूजा, राइट? मैं भी ऐसे ही करती थी. But if you see deeper, closely to the case, large ward में we have only 2 remedies, Mexsulf and Delcamara, lymphatic repertory, I guess. तो जब आप देख रहे हैं कि पेशेंट को वार्ड्स भी हैं, पेशेंट को और बहुत सारी साइकोटिक कंप्लेन्स हैं, है ना? सो व्हाई डोंट यू टेक साइकोसिस एज अ पैथोलॉजिकल जर्नल, यानी कि आप मायाज्म को भी वो ले सकते हैं, एंड दिस विल हेल्प यू टू बेटर चूज योर रेमेडी एंटी मायाज्मेटिकली. ओके, तो इसी तरह से डोमिनेंट मायाज्म, जैसे जैसे मैंने अभी आपको पीछे बताया था कि पैथोलॉजी को भी आप यूज कर सकते हैं. कैसे यूज कर सकते हैं? डायबिटीज है, टेक इट. पाठक रिपोर्टरी में लो ब्लड प्रेशर, हाई ब्लड प्रेशर दोनों अलग अलग है. यू विल नॉट फाइंड लो ब्लड प्रेशर इतना इजीली किसी भी रिपोर्टरी में. यू टेक इट. आई रिमेम्बर आई हैड अ पेशेंट 90/60, कम से कम हो गई, अब से कम 7 साल पहले की बात होगी, एमडी में रही होंगी मैं. एक पेशेंट आई ऐसे हाफती कांपती हूँ. अच्छा, हाई बीपी की तो मेडिसिन वी ऑल स्टडी नो इन थेरेपेटिक्स एंड एवरीथिंग, and she was like beep. It was 90/60. Okay. And कमाल की बात ये थी कि even after by giving electrol and ORS, it was not coming up. That time I saw my blood pressure देख रही थी, and I saw Fatak repertory में there is a subrubrical low, and I think gelsemium is there, cratagus is there. I think I have given her gelsemium because ये जो हालत है उसकी वो exposure by sun ही दिया था. See the causation I use and low blood pressure I use as a pathological general. Exposed to sun, and the remedy was gelsemium I gave. Within few doses she was absolutely okay in couple of months. तब मुझे भी खुद पर इतना भरोसा नहीं था कि this way patient will be fine or will be responding. Another thing is you can take constitution also. Patient nervous है, bilious है, sanguine है. You can take them as pathological general. I take bilious usually. कुछ पेशेंट बहुत ज्ञानी होते हैं, वो खुद आके बैठते हैं और बोलते हैं हमें पित्त का त्रास है. त्रास मीन्स प्रॉब्लम इन मराठी. पित्त की प्रॉब्लम है. And when you ask them, they'll say that every morning they get up and they, vomit a lot of bile, green, yellow vomiting every morning. They won't be fine unless they are, having vomitings. You can take rubric like bilious. And not to my surprise, remedies like Iris versicolora, Nux vomica, they have bilious temperament, constitution. So everything is linked. Once you start connecting the dots, materia medica and practicing and repertorization, it becomes cakewalk. Trust me. Okay, this is also very essential. Okay. अभी तक तो क्या था कि भाई बोगर की what is the concept of totality? What we have spoke about the philosophy, from where it came, right? Now comes the concept of totality. Okay. अभी क्या चीज ले कि केस में कुछ टोटलिटी ऑफ सिम्टम्स बन जाए. हम लोग ऑर्गेनल में भी पढ़ते आ रहे हैं टोटलिटी ऑफ सिम्टम. ऐसा क्या लें कि टोटलिटी ऑफ सिम्टम बन जाए? सबसे पहला कॉन्सेप्ट था टोटलिटी का प्रोग्रेसिव जनरलाइजेशन. आप चीजों को जनरलाइज कर दो. इतना जनरलाइज मत करोगे एक मिला और आपने पकड़ लिया. यू सी, एंड हियर कम्स द इंपॉर्टेंस ऑफ एनालिसिस एंड इवैल्यूएशन ऑफ सिम्टम. नाउ हियर कम्स हाउ आर यू इवैल्यूएटिंग द सिम्टम, how gross it is, how deep it is, what impact your symptom which you are going to take is altering or hampering patient. Give more important to generals than particular. If patient is saying I'm having pain in my hand, and patient is saying I'm having pain in my hand, and patient is saying कि numbness के साथ होता है, this numbness, मूंगी आती है, numbness or formication is there. So formication all in the body, numbness all in the body, and pain in just hand. So more than this particular symptom, you give more importance to a generalized symptom, which is numbness, formication. Always give importance to ODP of the case. What is ODP? It is onset, duration, and progress of the case. Here comes importance of causation. What brought you here? Always ask when you were absolutely okay. How it started? What happened? Not just in case of acutes, but in case of chronic also. Oh God, I had a case of 15 days ago, backache, I guess. Oh my God, oh my God, oh my God. Patient was taking treatment since it was second, third follow-up. And it was getting somewhat 10-20% better. Matlab. And at times you are not happy with what is happening. You are not happy. कि यार मतलब मजा नहीं आ रहा है. मतलब आप 3 बार दवाई दे चुके हैं, एक बार आप दवाई बदल भी चुके हैं. With all auxiliary line of treatment, patient is not better. I even don't remember what drug I have to do, but I'll share the case. Okay, the case is with me. मुझे ऐसा लगा कि मतलब, and she was quiet. बस कमर में दर्द है, कमर में दर्द है. I asked my junior intern, I asked her to take the case, and she was very new. बोली okay मैम. मैंने कहा okay, you take a side. तब तक I'll consult other patients. I consulted 8 patients and the case was not done. And she was writing. Even I was puzzled. मतलब, what is happening? And already 2 side में ना 8 pages का केस हो चुका था. और भगवान जाने वो इंटर्न ने क्या लिखा था उसमें. Then I read it and she told me the ODP of the case was 40 years ago. 40 years ago. And she got married. It was arranged marriage. And she had confronted her husband because he was cheating. He was having extramarital affair. And she couldn't take it. And what I was taking, that she's arrogant, she's haughty, okay, she's very dominating. Yes, sir. His kids have told me. The bystanders have her kids have told me. Bystanders have told, right? So when you take the case properly, the onset and duration, it came like 40 years ago. And what I was doing in back pain, I was trying the smaller remedies so that my patient gets better. And when you, what do you think about back pain? It's very cakewalk, bread and butter. If you're not able to relieve back pain, there's no point of practicing, right? When I again analyzed the case, the remedy came lycopodium. And it was nowhere when I took the case, I retook the case, nothing came. What I want to say here is the importance of onset. Patient might not know it, patient might not be interested in telling you. Maybe that was very discreet information. Patient was not sharing me even in the third follow-up, and my intern was very much successful in getting that information. So the causation, so that, and she told me, I asked what word. She was like, I was embarrassed. My world fell apart. My husband slept with someone else. I loved him. I've never loved anyone before. It's been 40 years. And he cheated me. Who can think that there could be embarrassment or love disappointment? And patient is only complaining of back pain. नहीं हुआ, 10% आराम है, 10% आराम है, 20% आराम है. हाँ थोड़ा ठीक है, योगा शुरू किया है. हाँ, right? Now you introspect yourself. Okay, what is wrong? So, how will you make totality? The generals, give importance to generals, give importance to causation, how long the patient has been suffering, and the progress. Few diseases, they're very slow. Slow. Fibroadenomas, slow. COVID was rapid. You have sneezing and fever today. 2 days later, pneumonia. There is a lot of patchy infiltration in your lungs, and you are in ICU on oxygen dependency just in 3 days, like that. So the progress of disease is very important. How disease is progressing. And my odd dear fellows, if you have such a progressive disease, don't think of slow remedies like Baraita carb and Calcarea carb. So if the the disease is making progress so fast, so you'll be needing a fast remedy like phosphorus. So keep that in mind, okay? Yeah, this is very important. This was typically Boger. The time dimension, as I've told you, patient is saying backache more in the 3 a.m., backache more 4 p.m. The time, at what time, है ना? Like we have in arsenic, midnight, midday aggravations, morning aggravations in sulfur and natrimune, sunset, sunrise aggravation, like, like night aggravations, syphilinum. Pathological journals, as I have covered. Another comes is tissue affinity. I will tell you about tissue affinity also. This is really, really important. There's a book, one of my most favorite, Blackwood's Materia Medica. I have taken lot and lot of sessions over this, and you read about it. You read a few drugs, then you'll have an idea actually how homeopathic medicine works. So we spoke about tissue affinity. This diagram I used to make in my MD, and this is very close to my heart. I'll tell you how. This says how time dimension work. It's not that boom, and you have diabetes mellitus, boom, we are suffering from hypertension, right? There is always a prodrome stage. The patient will say, कुछ अच्छा नहीं लग रहा है. बस मन अच्छा नहीं लग रहा है. Before even any acute or chronic disease, you'll always see. हम लोग क्या करते हैं? We wait for the symptoms to flare up, right? पूछने क्या हुआ क्या नहीं, कुछ नहीं पता. We wait. And we get to know that 24 hours के बाद they get fever. So that stage is prodrome, and always take care of that, what happened into that. Why this prodrome is important? Because you'll get lot and lot of generals in this. क्योंकि अभी कुछ बिगड़ा नहीं है. It is a very first stage. तो आपको symptoms भी भरपूर मिलेंगे. You are healthy and you have a certain kind of diathesis. My diathesis is nausea. If I have a period pain, I'll have nausea. If I travel, I'll have nausea. Okay, if I overeat, I'll have nausea. If I won't sleep, I'll have nausea. If I have any pain or anxiety, I'll have nausea. So this is the diathesis of patient, right? Disposition. So many people have bloody tendency. Even if it's a small cut, they'll bleed a lot. Menstruation, they bleed a lot. They have a history of nosebleed also, right? Blood disorders also. They have dengue also. So these are diathesis. So when patient is healthy and there's a certain kind of diathesis which varies from individual to individual, then comes disease, and that's how disease is progressed. So we have to keep this in mind also. There's always a functional phase, we call it as prodrome, and then comes the structural phase. 3 days ago, I had a case of follow-up of piles. Patient was 70% better. Okay. And I have gave her sulfur, 200 OD, 8 days. And she was fine in 8 days. Okay. To be very honest, I don't have time for long histories. If I require it, I call patient alag se to give the long history when I know there's something which is more to be for. I was a little free that last weekend. So I just said, okay, anus is usually body part. It is used to evacuate, excrete. But when you don't, you have anal complaints. So you need to forget and forgive if it is like that. The moment I said that, I don't know which button I hit. I've already given her the best second medicine, worst first best medicine already. And she was drawn into tears. She was like, I cannot forget, I cannot forgive what they have done to me. I was like, Arre baapre. Then I realized that these piles, these anal complaints, they're coming from, 3 years ago she got married and how she's being treated, right? So first, there is always a functional phase. You need to get that functional phase. And then you come up to, then disease progress to structural phase. Okay. Blackwood Materia Medica, I suggested. Okay. This is what we call it as, मैंने अभी बताया time dimension के बारे में. This is another example of time dimension. इसमें miasm भी बहुत अच्छे से fit होते हैं. We have sora, we have psychosis, we have syphilis, and somehow, somewhat tubercular miasm. I mostly believe in Master Hahnemann's 3 miasm only, and they are more than enough. Trust me. So we have taken example of tonsillitis also. Like we have only inflammation, redness, it is sora. There is pus, they are swelled up. There is pus, follicular tonsillitis, psychotic. And then there is ulcers, caseating necrosis started. Okay, it's very bad smelling, ulcerated tonsillitis. They become syphilis. And it is applicable to all disease disorders, pathologies. So you have to think from that point of view. अभी what I said के केस में इतना कुछ है क्या लें, how to get के what is important in case and what is not. Here comes the evaluation of symptom by Boger. To which symptoms Boger gave importance to. उसमें सबसे पहले आता है modalities. और modalities में भी causative modalities. How it started? Swimming, bathing in river, sun exposure, had cold drink, cake, that's shellfish. Okay. Modalities may you also have time modality, temperature modality, any posture, eating, drinking habit, pressure, touch, any modality. Mind comes later in Boger, unlike Kent. Kent gave most importance to mental generals or generals. And how we take the mind? We take the changed state. Patient was very happy. Since she is having headache, she has become devil. Oh my God, she's screaming, she's running around. She's shrieking around. Okay, so you will take mind of the change or the altered state. Then comes sensation. Patient now, they are very educated, very well aware, and they say burning, cutting, cramping, bursting, throbbing. Another very important aspect which Dr. Boger has came across was objective aspect, and I am very much fond of this. You see how patient is sitting or shaking the legs, the patient is restless, the facial expressions, and a frowning, grounding, picking lips, any color, odor, secretion you can see. Patient might not be aware of it because patient has not studied homeopathy, right? Okay, this is also important to tell. Another thing is the part affected. So much, so important. और इसी वाले evaluation की वजह से here comes the importance of tissue or organ affinity. For example, I'll tell you. Abhi, I have a case or patient is fair, fat, flabby, constipation, sweat mathe par, okay, milk desire, constipation, everything. Abhi hua kuch time pehle, and one of my junior intern, she came and she was like, ma'am, this is a case and I want to give calcarea car. Patient is too much calcarea car. I said, what are the present complaints? She was like, patient is having eczema or dermatitis. I even don't remember. Okay. I said, can you show me any book or reference where calcarea carb has covered atopic dermatitis or eczema? Or what part of skin calcarea carb is affecting? I said, okay, I agree that patient is calcarea carb. I changed her prescription from calcarea carb to sulfur. I said, let's give sulfur, a dose of sulfur. Even if you want to give calcarea carb, let's give a hold. Just give a dose of sulfur and wait. If you require, calcarea carb is complementary to sulfur. You can give calcarea carb later on, even if you know that it is a similar medicine. But calcarea carb is not covering the part, tissue, pathology at all. And that's what happened. Patient was absolutely okay and there was no need of calcarea carb. So that is the importance of part affected or tissue affinity. I'll tell you more examples. Abhi, we have Berberis vulgaris, right? Berberis vulgaris, I don't know. I think it is the most misused drug in homeopathy. Like we take like paracetamol or dolo in modern medicine. So, but do you think all kidney stones respond to Berberis vulgaris? Not at all, यार. नसीब है तुम्हारा कि 50 to 60% अगर cases तुम्हारे Berberis vulgaris से निकल गए तो. Consider yourself lucky. It's not like that. It's not how it works. If the kidney stone is obstructed, that you should be knowing the physiology, the physiological action of Berberis vulgaris, that it relaxes the ureter, or left-sided of kidney affections is there, then your Berberis vulgaris will act. So that's how tissue affinity is important. Else you should be knowing how Ocimum, Sarsaparilla, Parera bravia, Uva ursi, methylene blue, how all they are related. And not just the symptoms. What are the difference, in them to prescribe? Next comes the practical application. Its ability to efficiently identify the key characteristic symptoms, right? अभी आपको patient में बहुत easily symptoms मिल जाएंगे. Especially ऐसे cases में where physical symptoms are more prominent than mental symptoms. And generalized symptom करके or getting the concomitant along with the generalized symptom, you are easily able to prescribe now. अभी आपको ये कहने की जरूरत नहीं है कि हमें इतना लंबा केस लेना नहीं आता, क्या पूछे केस में, राइट? Okay. Moving forward, you focus on generals, you focus on concomitants. Those cases, in सब cases में आपको बोगर रिपोर्टरी हेल्प करेगी जहां पे बहुत सारे जनरल्स हैं, concomitant हैं, there's lot of mentals और clinical context. You have a diagnosis, है ना? You have any dominant miasms. ये तो कोई बताता ही नहीं है प्रैक्टिस में कैसे यूज करें. केस ले लीजिए. अब आपको पता है कि इवैल्यूएशन करने में आपको मोडालिटी, कॉजेटिव मोडालिटी, सेंसेशन लेना है, ऑब्जर्वेटिव सिम्टम्स लेना है. माइंड मिला तो ठीक है, नहीं मिला तो भी ठीक है. Then you have to, after taking the case, you have to select the rubric that best capture the essence of patient presentation. Then you have to analyze it. Once rubrics are selected, now you take it into consideration. Repertorization में आप manual करें या आप book से करें या आप laptop से करें. Now you come up with the first 4 remedies, you read them from Materia Medica, and now then you prescribe. It is as simple as that. Here's a very small case, little case. A patient is coming to you with chronic fatigue and headache. Our patient keh raha hai headache is worse in the afternoon. And there is a feeling of heaviness in limbs also. And especially from long sitting hours. They have a strong aversion to cold and tendency to feel better with moderate activity. थोड़ा थोड़ा चलते रहेंगे तो ठीक है. Now you can take rubrics like fatigue, headache, afternoon aggravation, aversion to cold, and better moderate motion. Simple है ना, कोई बड़ा केस नहीं है ना. 5 मिनट में जो पेशेंट ने बताया आपने वही लिया, आपने पेशेंट को प्रोब नहीं किया. Okay, when you use these symptoms in Boger repertory, remedy comes Kalikarp. And Kalikarp strongly aligned to the patients, those who have feeling of heaviness and they have aversion to cold. Right? So that's how simple it becomes. You can use simple, small cases and try to solve it with Boger repertory. The more you practice, the more you'll be able to use it in your practice. It's like your weapon. The more you know about it, the more good results you'll get. So I hope you have liked the session, loved the session. You can mail me if you have more queries about the session, or you can DM me on Instagram also. And I would like to raise my thanks to Homeopathy 360 for organizing such a long string of webinars and collecting speakers all across the globe and matching their daytime. I know how difficult it is. So thank you so much, Homeopathy 360. You've been always be kind with me, my sessions and my articles too. If you have questions, you can either ask or you can drop in the question answer section. Book I told you, it is Blackwood material.
Thank you so much, ma'am, for this wonderful session. And I would like to ask, can ask. And Dr. Anum Zaheer ma'am has taught us a wonderful way of how we can take case taking, and that is informative. Thank you so much.
If you have questions, please drop it in the comment section. Or you can ask live also. Someone asked about guide about gallstones. This is such a tricky question if you ask me. I have seen a lot on Instagram and on internet that there are so many practitioners that dissolve gallstones. But trust me, even in your duration or course of your treatment, if it becomes obstructed and it led to obstructive jaundice, it's going to be disaster to your practice. So better you know your scope and limitations both before you treat gallstones, how big it is, how if they are multiple or not, and what you are targeting. Are you targeting to dissolve them? Are you targeting to relieve the pain of patient? Cause of gallstone, it is due to liver induced or it is due to cholesterol, right? So you have to prescribe accordingly. There's so many medicines, available in materia medica, but the cause is, different in each, right? So, so you have to take care before taking a case of gallstones. There's a question, concordance repertory can be used in our daily practice. Of course, it is for that only. It is for second prescription, concordance repertory. What to prescribe next? Difference between Kent, Boger, and Wonninghausen repertorization, as I told you, Kent was a follower of generals. Mental general, physical general. Mental में भी उसके बाद भी will, understanding, memory, intellect. More mind. Wonninghausen was concept of grand generalization, concept of complete symptom, location, modality, location, sensation, modality, and concomitant. Boger was the one who bridged in between. He said modality, yes, but causative modality first. Time modality then, any abnormal posture then sensation, then observative symptoms, then mind, then sensoria. So the evaluation of the symptoms, the analysis of symptom was extremely different. So as their repertories construction. Painful corns aggravate on walking, standing for a long time, tried, and improve fluctuation, tried increasing potency. Have you heard of ignatia in corns? चलो let's do this. आपका case repertorize करते हैं. I'll take few seconds only of yours. Okay. आपने क्या बताया? कौन है? एक मिनट. मेरी स्क्रीन विजिबल है क्या आप लोगों को? अरे कहाँ गया? Zoom meeting. आपने इग्निशिया भी दिया हुआ है. 200 में क्यों दिया? When you have corn, always start with. Whenever you have a skin complaint, no, always go for low potency. Painful corns aggravate by walking, standing for long time. अगर मैं standing for long time को generalize ले लूँ ना, तो sulfur could be the remedy if it corresponds to the symptom. और कुछ नहीं है. Painful corns and walking. Painful corns. Corn, pain, walking. Okay. What symptom? You have rhododendron also. I don't know whether you have given or not. पर यार कम से कम 3 सिम्टम तो लाओ. इतनी भी क्या स्कैरसिटी ऑफ सिम्टम है कि भोगा रिपोर्टर यूज करने की. You can think of something deeper than if you have given. और इग्निशिया ना 30 में दो. I have given 30 में और LM potency में and I've got results. अगर कलर देख लो, अगर येलो कलर है ना तो hydrastis can be remedy. Rhododendron also while walking में दिक्कत करता है ना pond में. और you think of sulfur also. ये भी हो सकता है कि कोई ना कोई miasmatic block हो and that's why your remedy is not working. और standing aggravation में sulfur is excellent remedy. अरे येलो कलर I told you. You can think of hydrastis also. Read hydrastis. अरे देयर इज नो सच डिफरेंस बिटवीन बोगर एंड बॉनिंगहाउसन. जो भी बॉनिंगहाउसन के लिमिटेशंस थे ना वो बोगर ने ब्रिज किए, उसे और बेटर कर दिया. जो जो क्रिटिसिज्म आ रहा था बॉनिंगहाउसन का कि भाई ग्रैंड जनरलाइजेशन वाला, उसको ही बोगर ने फिलअप किया है. एंड बोगर केम अप विद द कॉन्सेप्ट ऑफ पैथोलॉजिकल जनरल एंड टिश्यू एफिनिटी, द कॉजेशन मोडालिटी ओडीपी. ये सब बोगर का ही किया हुआ है. बॉनिंगहाउसन वाज जस्ट ग्रैंड जनरलाइजेशन एंड कंप्लीशन ऑफ द सिम्टम. एंड कॉजेशन वो था ना कोई कुबी वाला, that was of Bonninghausen. Any other questions? So I hope you all have enjoyed the session. Thank you so much for being so patient listener. Always give small potency in cases of skin. When it comes to skin, always give smaller potencies. 200 क्या होगा 200 से? और एक डोज देके बैठ जाओगे? Always give frequent repetitions यार. So thank you so much once again for being patient listener. We'll be back definitely. Next session के लिए I would like to raise my thanks to Dr. Mansi. She's been very, very patient for months with me because there was a lot of things going professionally and personally, and she was so kind,
Thank you
so
so much, ma'am.
patient. Okay, ma'am, we'll do accordingly. Okay, ma'am, okay, ma'am. So I've learned this from you, Dr. Mansi. Thank you so much.
Thank you so much, ma'am. Thank you so much. And the recording will be available soon on the YouTube. So all the participants can have this session recording on the Homeopathy 360 YouTube channel. And if they have any reviews, any suggestions, please comment down. And thank you so much, ma'am, for your precious time you have given to us. And today, once again, you have educated us a lot and we learned a lot from you. Thank you so much, ma'am.